Matisol. I am a fourth-year resident at the Vall d'Hebron University Hospital in Barcelona, and I'd like to present my work titled Proclarix Aids in Resolving Indeterminate Multiparametric Magnetic Resonance Imaging for the Improved Diagnosis of Prostate Cancer. I have no potential conflict of interest to report. As a brief introduction, mentioning that the use of MRI has been a significant advance in the diagnosis of clinically significant prostate cancer, considered those is subgrade grade 2 or higher, and it is thus recommended in most of the current guidelines. However, it still remains unclear how to deal with indeterminate MRI findings, considered those period 3 categories. Proclarix is a novel CE mark test which aids in the identification of clinically significant prostate cancer. It provides the risk of clinically significant prostate cancer based on thrombospondin 1, cathepsin D, PCA, and percentage of free PCA in addition to age. Our objective was to assess the potential of Proclarix to resolve indeterminate MRI period 3 categories in order to help in the decision making of whether or not to biopsy the patient. We compared Proclarix results with those of PCA density and one of the most important risk calculators, the Rotterdam European Randomized Study of Screening for Prostate Cancer. In order to do so, we evaluated Proclarix in samples from men with an indeterminate period 3 in the MRI finding, recruited at the Vall d'Hebron University Hospital in Barcelona, and in the INDIVAT study in London. Both biobanks involved men undergoing MRI followed by targeted biopsies. The diagnostic performance of Proclarix was established in correlation to biopsy outcomes. Its performance was compared with PCA density and the MRI ERS-PC risk calculator. The results obtained were the following. In the population of men with an MRI period 3 categories, the median of age was of 66 years old and the PCA was of 5.9. 34 men were diagnosed of clinically significant prostate cancer in the biopsy. The AUC of Proclarix was of 0.72, which was higher but not statistically significantly different when compared to PCA density and the MRI ERS-PC risk calculator. On the other hand, the negative predictive value and the sensitivity were high and similar for all three tests. However, Proclarix did not miss any patient with clinically significant prostate cancer, whereas the risk calculator and the PCA density missed one patient, grade group 2, and finally, Proclarix specificity was significantly better compared to both PCA density and the risk calculator. So, in order to conclude and as take-home messages, mentioning that Proclarix can be used in patients with an indeterminate MRI findings by safely ruling out negative cases and reliably identifying clinically significant prostate cancer with 100% of sensitivity. On the other hand, commenting that Proclarix was able to outperform PCA density and the risk calculator in terms of specificity, being able to a higher reduction of unnecessary biopsies. Thank you very much for your attention.